Hi, Mr. Schaefer.
Yes.
What would you like me to call you today?
We're Will or William.
Okay, so my name's Ellen. I'm going to be the nurse practitioner doing your exam today. Two parts to our exam today. We're going to do a neurological exam and a musculoskeletal exam. So with the neuro exam, lots of questions, lots of little tasks that I'm going to have you do. So just follow along as best as you can, and we'll just get started with our exam.
Sounds good.
All right. So to start off with the neuro exam, I'm just going to ask you some different questions, and you just answer them, and we'll just go from there. So can you give me your full name?
William Stephen Brad Schaefer.
Okay, and your birthday?
10/24/2001.
Okay, and what month is it right now?
Right now it is December.
And what year?
2021.
Perfect. So now I'm just going to ask you to do a couple tasks, and you just go ahead and do those for me. So can you close your eyes? Can you open your eyes? Can you lift your arms up in front of you like this? Can you stand up at your chair? Good job. Now I'm just going to pick up some objects, and you just tell me what those objects are, okay? So let's see. What do we have? What is this?
Pen.
What is this here?
Paper.
How about this?
Table.
Good. Very good. So now I'm just going to repeat some words, and you just repeat them back to me, okay?
Yep.
So chair.
Chair.
No ifs, ands, or buts.
No if, ands, or buts.
Perfect. All right. So now what I'm going to do is I'm going to have you write out a sentence here for me. Anything you want, just go ahead and write a sentence there for me on the notepad. Very good. Perfect. So now what I'm going to do is I'm going to have you cover each eye individually, and then I just want you to tell me when you see my fingers, okay?
Okay.
So go ahead and cover one eye.
I can see it. See him. See him. See him. See him.
Okay, go ahead and cover your other eye.
See him.
Very good. So now I just want you to follow my finger as you see it moving around, okay? Good. Very good. Okay, I'm going to check your pupils next. So with that, I'm just going to shine a light in your eyes, and you just look straight ahead of me, okay? So what I'm looking for here is that your pupils are equal, they're round, and they're reacting together. So yours were, so that's good. So now what I'm going to do is I'm going to have you close your eyes, and I'm going to touch your face with this a dull object, and you just tell me when you feel it, okay?
Right down.
Okay, does it feel any different here? How about over here?
No.
Okay.
Good.
Good. All right. So next, what I'm going to have you do is I'm going to poke your face with a little bit of a pin, and you just tell me if you feel the equal on each side, okay? Okay. Okay, now what I'm going to have you do is close your eyes, and you tell me which side that you're feeling it on, okay?
Left. Left. Right. Right.
Very good. So now I'm going to have you just do a couple more tasks. Can you scrunch up your forehead? Good. Can you open your mouth real wide? Can you stick out your tongue? Good. Can you do like a kissy lips, like duck face? Good. So now what I'm going to have you do is, can you shrug your shoulders up like this, back down? Can you stick your arms out to the sides? Can you bring them into this middle like this? Perfect. Now what I'm going to have you do is stick your arms out like this for me, and I'm just going to put some pressure down, and you just keep your arms good. Now can you push down on my hands? Very good. Can you squeeze both my hands nice and tight? Good job. All right, so now what I'm gonna stick my finger here. what I need you to do is you touch your nose and then you touch wherever my finger is at, okay? So go ahead and touch your nose for me and then touch my finger. Touch your nose. Here, good. Good job. Very good. So now what I'm gonna have you do is, can you stick your one leg out for me a little bit? So what I'm gonna do is the Babinski test. What I'm gonna do is take a dull object and rub it along your foot and go up to your toes here, okay? And now what I'm looking for is that your toes scrunch forward, which they did. An abnormal result would be your toes flaring outwards like that, okay? So now I'm just gonna have you step over here and we're just gonna do some simple tasks like this. So can you just start over here for me? And then just walk straight ahead towards me. Good. Now can you walk back the other direction with one foot in front of the other? Good job. Can you walk sideways? No, just normal. Yep, there you go. Very good. Okay, next I'm going to do the pinprick again, but I'm going to do it on your extremities. And I'm just going to have you tell me whenever you feel it. Okay, so go ahead and close your eyes for me. And just put your hands on your legs together. Nope, just normal. There you go. Can you feel that?
Mm-hmm.
How about over here?
Mm-hmm.
And does it feel any different, the sensation up here in your arms? Okay, same thing. I'm going to touch one and you tell me which side you're feeling it on, okay?
Mm-hmm. Left. Left. Right.
And does the sensation feel equal on both sides as well? Okay, good. So now what I'm going to have you do is run your heel of this foot along your shin and up to your knee like this, okay? Okay, can you do that with the other side as well? Very good. So that will complete the neurological part of the exam. Next, we're going to move on to the musculoskeletal exam. So to start that, I'm just going to take a general glance here at William, looking for any masses, lumps, bumps, abnormalities with his extremities. I'm not seeing any with that. So I'm just wanting to feel for his muscles and feel for any lumps. Not feeling anything with that either. Same with his legs. Look for any discoloration, any abnormal bruising, anything like that. So we're not seeing anything with that either. So I want to get a little bit of a background with you. Have you had any major musculoskeletal injuries before? No surgeries or?
I've had ACL, meniscus, and labrum surgery.
Okay, so were all those sports related injuries? Okay, and you have been doing well since then?
Mm-hmm.
Are you having any pain during physical activity, anything like that? And do you wear any braces while you play sports? Okay. So what I'm going to have you do here is just, again, squeeze both of my hands nice and tight. I'm going to do some passive and active range of motion with your arms, okay? So can you just extend and just keep doing that for me? So I'm feeling the joint here, feeling for any crepitus. I'm not noticing any swelling. Are you having any pain while you're doing that?
Mm-hmm.
Can you do that with the other side as well? Very good. And now can you just out and in with your knees? I'm not hearing any cracking, no crepitus is felt. Can you do that with the other side as well? Good. And now you just relax and I'm just going to do the movements for you, okay? Good job. Can I see this one over here? Go ahead and flip your hand. Good. Same thing here, just go ahead and let your leg dangle. Okay. Good. Now with your shoulders, can you go like that with your shoulders? Okay. Now which shoulder did you have the surgery
My
on?
right one.
Right shoulder. Any pain felt while doing this?
No.
Okay, good. So now what I'm gonna have you do is, can you just stand up for me? Can you reach down and touch your toes? And can you squat down, like almost like a catcher's position? Any pain felt with that?
No.
Okay, good. Go ahead and take a seat again for me. Also, I just want to take a general look at his fingers, any abnormalities in the joints. Nothing felt, no lumps or bumps are seen here. Same with this hand. Any issues with your feet or toes? No? Okay, good. So that will complete our musculoskeletal exam, and that'll be it.